Being involved in research and the impact that has on clinical practice is something I'm really passionate about. So my session today is showing nurses, I think mostly it will be nurses in the session, but it's showing them how being involved in research can really affect practice and change practice. So I'll start off by asking why it's important, then I'll look at how it can help, and then I'll use some examples from my own practice where I've changed local, national and international practice using research. Some of those examples I'll be giving have been examples where I've changed national practice. So for example, within chemotherapy nurses that administer chemotherapy and the way that chemotherapy is administered had been changed through nursing research. So that was a couple of years ago, well about 5 years ago we did that. And we proved really that by giving chemotherapy in the way that we were at that time as a one-stop, where patients would come on one day, we showed how that impacted and it caused anxiety not only for patients but also for nurses. And what that research did was show that we could change practice and we could make it more efficient and less stressful for everybody concerned. So the latest innovations for nursing and for nursing research are to look at the latest treatments and look at ways in which we can help support patients that are having those treatments. So for example, one of our big studies has been to look at looking at supportive care guidance for patients having immunotherapy and targeted therapy. And of course that will carry on now for the CAR T cell studies too. So what we did with that was that we first looked at patients' experience of being on immunotherapy and their relatives, their carers. That was a qualitative study. We then went from there to look at a Delphi technique of looking at how experts could give advice and give care guidance. And then following on from that, we've looked at looking at data in real time. So we've got an app where patients can put in their own reported outcomes, and then we can look at big data, at real world data. So there's a number of reasons that nurses should attend big conferences like this. The first, of course, is to understand the innovations that are coming. So there's been lots of sessions about CAR T cells, there's been sessions about innovations in practice in treatment, but there's also been, if you think about Dame Sally's session just then, about what we need to think of going forward, how we need to look at antimicrobial resistance and how we need to feature that in our everyday. So that's one area where it's important, but the other area is that actually it really enthuses nurses, it makes them want to be involved in research, and it informs their practice when they go back. So it's a really good idea for nurses to attend conferences like this.